is 110, blood pressure is 90/60, do the primary survey. Sometimes the question comes as do the initial assessment. What is the initial assessment? Primary survey. Yeah, don't get confused in the exam. Can I just put it very much? Yeah, thanks. Good. Next line. I'm assuming you're my examiner. Yeah? Okay. When I ask for exposure, just say assume is exposed. Right? So I'll repeat the question. Mr. Smith went to the road traffic accident, brought in the hospital. Pulse is 110, blood pressure is 90/60, do the primary survey. I want somebody to time in, tell me 130 seconds are remaining. Who's going to do that?
We are doing it.
Okay.
Who is doing it?
We do it by the camera. So
yeah. Okay. So when 4.5 minutes are up, just tell me 30 seconds remain. Yeah? Okay, you're my examiner. Okay, start. Good morning.
Morning.
This is my number. Can I start my task, please?
Yes.
Thank you very much. I assume I've taken all the universal precautions. I assume the trauma team is with me. Well, Mrs. Smith, are you all right?
Okay.
Mrs. Smith, I'm Dr. Swami here, one of the doctor here to examine you. Is that okay with you?
Yeah.
Thank you very much. Since he's speaking, he is conscious and his airway is patent. Ideally, I'll do the triple immobilization and I'll give him high flow oxygen. I'll request the nurses to connect all the monitors to the patient and also request them to arrange for the primary series of X-ray, that's a chest X-ray, pelvic X-ray, and the lateral, the cervical spine X-ray. Mr. Smith, I need to examine you now, okay? For that purpose, I'll have to cut and remove all your clothes. Is that all right with you? Okay, thank you. What shall I do here?
Assume.
Thank you very much. I'll look for any problems with the breathing. I'll look for any breathlessness. Mr. Smith, I'm just going to have a look at your neck, okay? I'll look for any engorgement clearance, any tracheal shift. I'll examine that. Can you put your hand down, please? Thank you. I'll examine the chest for any bruises, any open wounds, any flail segment. Mr. Smith, can you take a deep breath for me? Thank you very much. I'll look for any asymmetrical chest wall movement. Can you take a deep breath again? Thank you. I'll check for the expansion. Mr. Smith, I'm just going to tap on your chest, okay? Tell me if it hurts anywhere. I'll focus for any hypersense or dullness. Mr. Smith, can you take a deep breath again, please? Thank you. I'll auscultate for any absent or diminished breath sounds, also for any muffled out sounds. I assume the chest is fine. I'll look for any bleeding anywhere. There's no signs of any external bleeding. Excuse me, can you check it? Can you look up for me, please? Thank you. I'll check for power. I'll feel for any cold peripheries. From the monitors, I know his pulse is 110, blood pressure is 90/60. I will insert 2 large IV cannulas both the forearms and I'll draw the blood for all the routine blood tests including grouping and cross matching. I'll rush him with that 2 liters warm Hartmann solution. Then look for any signs of internal bleeding. I would examine the chest. I'll examine the abdomen for any distension, any bruises, any open wounds. Mr. Smith, does it hurt anywhere on your tummy at all?
No.
Okay. Just going to tap on it, okay? I'll focus for any flank dullness. I'll auscultate for any absent or sluggish bowel sounds. I assume the abdomen is fine. And look for any signs of fracture of pelvis. I'll look around the pelvis for any bruises, any pelvic deformities, any scrotal hematoma, any blood at the external urethral meatus. Mrs. Smith, I'm just going to squeeze on your hips, okay? Tell me if it hurts anywhere.
It hurts.
I'm sorry about that. I think it's got fracture pelvis. I have already resuscitated him. I'll apply pelvis trapping and call for the orthopedicians for external pelvic fixators and for further management. Now look at both the thighs for any signs of fracture femur. I'll look for any bruises, any deformities, any swellings, which I don't see any. Mrs. Smith, does it hurt in your right thigh here at all?
No.
That side? Okay. I'll check the distal pulses. I assume both the thighs are fine. Since he has been speaking, he is conscious. I did check his pupils. I'll keep him covered with a warm blackness to prevent any hypothermia. I'll insert the NG tube and a urinary catheter. And once he is stable, then I will do the secondary surgery.